tell you a little bit about how we approach a torn meniscus. So the meniscus is a cartilaginous structure in the knee, which acts as a shock absorber primarily, as well as also provides stability. And in each knee you have two menisci. So there's an inner one and an outer one, or a medial one and a lateral one. Most commonly the medial one gets injured. And treating torn meniscus is one of the most common procedures that in all of orthopedics. Unfortunately, it's one of those things that can go along with getting some early arthritis or age-related degeneration of the knee. So when you tear your meniscus, it can be either in an acute traumatic fashion, like getting tackled playing football, and that tends to happen in sort of the younger crowd, in the teens and 20s. And then there's sort of another group of people that tear their meniscus, and they tend to be sort of in the 40s to 70-year-old group, and they have usually some more degenerative change associated with that. There's basically two ways or I should say 3 ways to treat a torn meniscus. Number one is to do nothing surgical, is to try anti-inflammatory medications, some rehabilitation, and I would say a smaller percentage of people can do very well with that type of treatment. The other treatment would be surgical, and in the surgical realm of treatments you can either debride the meniscus, or what's known as a partial meniscectomy, so you're taking part of that meniscus, the torn part, out, or you can repair the meniscus, and repairing the meniscus involves actually sewing that back together. There are different patterns of torn meniscus that are more amenable to different types of treatment. Usually people that are in the younger age group, they tend to tear their meniscus sort of at the outer rim of the meniscus, and that's where the blood supply is the best. So those types of tears, which are in a longitudinal fashion, have the best chance of healing if you were to sew them back together. So we know that the meniscus serves an important function in the knee in terms of preserving and helping to distribute that load and preserving the articular cartilage. And so if we can, I think preserving the meniscus and repairing it is the best thing for the knee. Oftentimes in the second group of patients, the slightly older group, the meniscus will tear along the inner edge of the meniscus. And that inner edge is just where there's essentially no blood supply. So often we're faced with a situation where even if we were to sew it back together, that often wouldn't heal. And so then you're sort of stuck, again, having to trim that out. So what we do instead is actually trim out a small portion of that meniscus, analogous to having a hangnail. That tissue is just sort of flapping in there and can cause catching and blocking, that sort of thing. So if we trim out that torn hangnail piece of tissue, you're left with a nice stable remnant of tissue that works, albeit a little bit less. The rehabilitation after either type of meniscus surgery is certainly very different. If you've had a meniscus repair, it often requires a prolonged period on crutches as well as a brace, and usually return to full activities more like 4 months after surgery. Whereas if you just take a small piece of tissue out, we're not waiting for anything to heal, and so you can often get back to those activities that you want to do within 4 to 6 weeks. So certainly there's advantages and disadvantages to both types of treatment, and I perform them both. But I would say most commonly, if you look at all the numbers, the one we're doing is trimming out that meniscus to try to get people back as fast as possible.